Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Welcome to Gateway Today, the show that talks all things Gateway Community Health Center. I'm your host, David Kash Vasquez, and we're talking about how you can benefit from becoming a patient here. And we've been busy. That's a good thing, right? That means that our efforts in the community have continued to skyrocket as we continue to promote all of our services at the clinic. Medical, dental, and behavior health are all at the top of the list, and more recently, our push to provide free, no-cost COVID-19 vaccines to people of Laredo, Zapata, and Havermville have been equally as important. This has all been through the support of the federal government. As you may know, Gateway Community Health Center provides high-quality health care to all, no matter your ability to pay. So whether you have insurance, you don't have insurance, we create access to healthcare. Therefore, the partnering with our federal government has been a key driver to our success. A big thanks to our Congressman, Henry Cuellar, who has been instrumental in securing funding. And we recently got a chance to connect with Congressman Cuellar in Washington, D.C. and the National Association of Community Health Centers to spread our message of continuing to create access to healthcare. Plus, coming up in today's show, we head over to Texas A&M International University for the Continuing Education Day, where we worked with students to promote and raise awareness about various community health issues and services Gateway can provide to our young people. It was an amazing time to see students come together and understand the importance of health and what it means for them. And as many of you know, April is Autism Awareness Month, and we got a chance to catch up with Dr. Daniel Garza, Laredo's only pediatric neurologist, who spoke to us about autism. Dr. Garza shared his experience with parents who are raising children with autism and providing valuable insights into the history and science of autism. He'll share some important information with us on the condition and his upcoming lecture to parents at the Genetic Conference and Resources Fair. We've got a lot of show coming your way, so don't move. Another episode of Gateway Today starts now. The success of Gateway Community Health Center is attributed to the support of the federal government and Congressman Henry Cuellar, who has played a significant role in securing funding for our operations. Recently, Gateway Community Health Center had a chance to catch up with the Congressman and the National Association of Community Health Centers in Washington, D.C. to continue pushing our need for access to healthcare in our community. Check it out.
You know, there are more community health centers in this country than there are Walmart sites. We just heard about that last year. And the reason that they're so important is because when you need health care and you need to be able to afford it for you, for your children, for your abuelitos, for your madrinas and padrinos, it's important that you be able to access that health care, not just medical, but we're talking dental, behavioral health, a lot of the social services, a lot of health education and preventive care. You're only going to get that at a community health center.
So let's welcome and show our appreciation and gratitude for an outstanding leader, Senator Bernie Sanders.
That whether you're rich or you're poor or you're middle class, health care is a human right, not a privilege.
Rachel Gonzalez Hansen. I'm the interim president and CEO for the National Association of Community Health Centers. NAC has been around for a little bit over 51 years. And it started because there was people that understood that these health centers across the country, because there was just so few back then, that they needed to have a national voice. Someone that was in DC to make sure that they stayed on top of all the legislative situations, all the legislative matters to protect health centers, right? We knew that we couldn't do it unless we were doing it together and united. So as an organization, we're about making sure that we stay ahead and leading the health center movement so that we can keep on going.
We know that if people have access to primary care, it's not only going to keep them healthy, but it's also going to save the healthcare system billions and billions of dollars. But the most important thing is we want to make sure that everyone has the right to health care and has a place to go for care. And that's what the community health centers are all about. I am Jana Eubank. I'm the Executive Director of the Texas Association of Community Health Centers. You know, it's really important that we never take for granted the bipartisan support that we have on Capitol Hill. And so one of the main reasons we come and join together is to learn about a lot of the policy challenges facing community health centers and more importantly our patients, and then go and share that information with our lawmakers on the Hill. We need their support to provide high quality comprehensive care to 1.7 million Texans.
Well, this gives us a lot of good information about what's happening in our Congress right now, especially regarding funding of our tremendous work that we do in community health centers across the country. We want to continue expanding our services in our communities of Laredo, Zapata, and Hebbronville. Your health is your wealth, and that's what we're trying to make sure that people understand. Come see us, get primary medical care, primary dental care, and primary behavioral health care.
The fight for high quality healthcare for all continues, and Gateway Community Health Center is proud to be a champion for this mission and the efforts for you and your family. And speaking of those efforts, Gateway Community Health Center got a chance to talk to students at Texas A&M International University to raise awareness about community health issues and services. The Community Engagement Day event was successful in promoting the importance of health among young people. Check it out.
My name is Rocio Rodriguez. I'm a health educator for Gateway Community Health Center. Today we're here giving information to our students about our clinic, informing them that we have affordable health care for everyone, including themselves and their families. The students were not aware that even though they don't have insurance, they can be seen at Gateway, and they were not sure about all the services that are provided, everything under one roof, like example, like our pharmacy, our labs, our nutritionists, dietitians, their information in regards to their COVID vaccines and how to register online services, patient portal. That was something they wanted to do. So that was super convenient, teaching them and letting them know that now everything's like super computer savvy, where they don't have to waste time and be waiting in lines. They can literally just do everything under the website. You know, they're at school, they're working, some have 2 jobs and come to school. So that was wonderful. I thought that for them, bringing those services out here was very important today.
I'm excited because we get to see all the students here at TAMU. We get to socialize and interact with all the agencies that we have in the community. and having a lot of topics on diabetes, nutrition, clinic information for everybody in the community. And that's the thing, that's the best thing, information, the customer service, the attention to the patient. The patient does not leave there without not knowing what's their next appointment. They always have their follow-up appointment. They always get to have like everything in one stop.
It's called Community Engagement Day, and what we do is we have our first year freshmen set out and do different activities with nonprofit organizations. So what it is that we provide the course description. So each class does a specific project, a lot of awareness or things that they've assessed that the community needs. For example, awareness, suicide awareness, alcohol awareness, prevention, a lot of prevention. Also, students right now have seen a raise in use of like steroids for students that work out or people that work out. So they're doing a lot of awareness on that too, because that's a very important thing that we always encourage our students to seek out, and it's their well-being and their mental health stability. So we also talk about that a lot in class, and we point them out into the right direction. And the community organizations, for example, like in this case, Gateway, they can provide the services that they provide, that the students can know that they're out there, and specifically that they're not alone. So sometimes they don't know who to turn to, or the agencies or clinics that are out there. That's why we do this. So basically what we do is we bring the community to TAMU. So one of the big takeaways from these activities is that the students have the cultural sensitivity. The nursing students, they come out very well prepared. So they're ready to go out into the community and work. So those are one of the things that's why we bring these community agencies, for example, like Gateway, so that the students can know that there's always options that they can go out and develop their professional lives and their careers.
Always a fun time at TAMU, and we're thankful to Dr. De La Mier for the invitation to participate. Next up, April is Autism Awareness Month, and we head over to Laredo's only pediatric neurologist, Dr. Garza, to talk about the impact of autism in our community. Stay tuned. More Gateway Today coming up after this.
El COVID-19 sigue impactando a nuestra comunidad. Estamos ayudándote a mantenerte sano. Gateway Community Health Center está ofreciendo vacunas contra el COVID-19 sin costo. Visita cualquiera de nuestras clínicas y vacúnate. Las vacunas están disponibles sin costo para adultos y niños mayores de 6 meses de edad. No necesitas hacer previa cita, simplemente visita cualquiera de nuestras clínicas. Para más información visita gatewaychc.com o llama al 956-795-8100.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.
COVID-19 is still impacting our community. We're helping you stay healthy. Gateway Community Health Center is providing vaccines at no cost to you. Visit any Gateway Community Health Clinic and get vaccinated. Vaccines are available at no cost for children 5 years of age and older and adults. Get the vaccine today to help our community stay healthy. Walk-ins are always welcomed. Simply visit any of our conveniently located clinics. For more information, visit gatewaychc.com or call 956-795-8100.
For thousands of residents in Webb, Jim Hogg, and Zapata counties, Gateway Community Health Center is a viable link to quality healthcare services that might not otherwise be available to them. What most people don't realize is that these 6 clinics scattered throughout the 3 counties mentioned and the services they provide are open to everyone. It is a true gateway to good health that provides numerous healthcare services to all who come through their doors. Its mission is quite simply to provide quality care for everyone. This nonprofit organization is a lifeline to literally thousands of people who have limited resources and cannot afford traditional health insurance. It allows anyone, regardless of ability to pay, the healthcare services that would otherwise be out of reach. In short, it can extend lives through proper medical care and attention. Low income, median income, or upper income, it doesn't matter. Here, anyone can get quality health care that can fit within any budget. Payment arrangements are geared to the individual and that individual's ability to pay. And more importantly, no one is ever turned away. Among the services offered at Gateway Community Health Center are child and adult primary care, women's health, dental health, specialty care, support services, urgent care, weight management programs, diabetes care, and much, much more. It's important to mention that everyone qualifies for healthcare services and registering is easy. And for anyone needing assistance in obtaining health insurance from the health insurance marketplace, we have certified counselors available to help with applications year-round. There is also assistance available for those applying for Medicaid. Now, when it comes to general healthcare services, adult primary care is high on the list. It includes the diagnosis, treatment, and prevention of acute and chronic diseases and immunizations. We do screenings for diabetes, high blood pressure, cholesterol levels, and other issues. If hospitalization is necessary, Gateway has a hospitalist program whereby inpatient care is provided at a local hospital by a group of local physicians. From admission to discharge, these doctors coordinate care with the patient's primary care provider, or PCP. Pediatric care is another service that falls under this heading. It's provided to newborn infants and children up to the age of 18. Gateway provides both well-child and acute care. Immunizations are also offered for children and adults at all clinics, and medical checkups are also on the list of services for patients in all age groups. Specialty care services include behavioral health, which include counseling and psychotherapy to children and adults. There is even an urgent care clinic open to the public at large, located at the Central Clinic. It's open after hours and is open to anyone who needs care for an acute, non-emergency, or non-chronic issue. And when it comes to women's health, Gateway offers breast and cervical cancer screenings. Diagnostic exams are provided to eligible women who would otherwise not be able to afford such services. In addition, Pap tests and mammograms are provided at no cost to eligible women over 40 and over 50 years of age, respectively. Gateway offers sexually transmitted disease or STD testing as well. Gateway Community Health Center serves as the family medicine outpatient clinic for the University of the Incarnate Word School of Osteopathic Medicine residents. Under supervision, these doctors practice adult medicine, pediatrics, and women's health. It's widely known that healthy teeth and gums are vital to good health, and that is exactly why Gateway Community Health Center includes dental services for patients. Our dental clinics offer services including preventative, restorative, and limited oral surgery services for children and adults. Preventative services include dental exams, x-rays, cleanings, oral hygiene education, and dental sealants. Restorative services include dental fillings and pediatric dental crowns. These clinics offer limited oral surgery that includes routine tooth and molar extractions. In addition, our dental clinic serves as an external teaching site for internships for senior dental students from the UT Health Science Dental School in San Antonio. Support services at Gateway include 2 pharmacies that accept Medicaid, Medicare, and private insurance. We also offer in-house laboratories and imaging services performed under contract with local hospitals. In addition to diabetes management programs, Gateway Community Health Center offers diabetic supplies whereby eligible patients may receive glucometers, strips, lancets, and solutions at a discounted and affordable price. There's even nutritional therapy assistance and a children's weight loss management program that can prevent bad eating habits in children without it developing into full-blown diabetes. Bottom line, Gateway Community Health Center's 6 clinics have numerous services that can accommodate just about anybody who needs quality health care at a reasonable cost. At Gateway, everyone qualifies for services. All you have to do is enroll, and we'll take it from there. We're here to improve the quality of life of every person who walks through our doors. Our core values are service excellence, professional expertise, integrity, dignity, and compassion for all. We are Gateway Community Health Center. In closing, here are a few words from Gateway's Chief Executive Officer, Elmo Lopez Jr.
Here at Gateway Community Health Center, we provide quality health care for everyone. We provide primary medical care, primary dental care, primary behavioral health care, pharmacy and lab services, all under one roof. I invite you and your entire family to visit us at Gateway Community Health Center.
Welcome back to Gateway Today. And earlier we talked about April being Autism Awareness Month. Recently, we got insights from Laredo's only pediatric neurologist, Dr. Daniel Garza. He shared his expertise on autism and provided valuable insights into the history and science of the condition. He'll also be speaking at the upcoming Genetic Conference and Resource Fair happening April 28th at the Joe Guerra Public Library right here in Laredo, and will be providing parents with important information on the condition and its development over the past 80 years. Check it out.
I'm Dr. Daniel Garza. I am a pediatric neurologist, been practicing in Laredo for the past 25 years. Autism is a neurodevelopmental disorder. It is mostly genetically determined, but there are a variety of causes for autism. We have learned more about autism in the past 20 years than in the previous 80, which is when the condition was originally described. Autism, even in the 21st century, is a clinical diagnosis. Incredible in this day and age where you can show a test and say, yeah, you're positive for COVID, you're positive for flu, you're positive for HIV. For autism, it is still based on behavior, on how the child interacts with other people. Basically a clinically based, a behaviorally based diagnosis. There are no tests that can rule it in or out, is other than getting a good history and interacting with the child. Laredo, it's a very special city because of our geopolitical situation, right next to the Mexican border. So we have this mixture of cultures and basically a bilingual society. So that definitely has an impact on language development and language acquisition in children. So we've learned over the years to take that into account when you're dealing with autism. Autism has changed dramatically over the past 30, 40 years. I mean, the incidence has skyrocketed, despite what some of the lay press may try to say otherwise, arguing that the diagnostic criteria have changed and the public awareness has increased about autism. The reality is that when I first started here in 1998, we would probably see 5 or 6 cases per week. Now I see on average 10 to 12 children with autism every day of the week throughout the year. So it is a humongous increase in the incidence and frequency. There are many causes of autism. The biggest one is genetic predisposition, but I think that, personally, the pollution in the world, we have been gradually poisoning ourselves and is catching up to us, I suspect. Between lead and plastics and the antibiotic use we've been using and abusing for the past close to 100 years, and altering our microbiome, these are all influences, and I just don't see any other option. We used to say that the children that are being born today are exactly the same as the children that were born 10,000 years ago, and I really disagree, because the children being born today have been exposed already, even in utero, have been exposed to antibiotics, and the moment they're born, they're already being treated with antibiotics to prevent eye infections and other issues. So I think that has really altered our relationship with this world, and that probably has impacted our biology. Since I've been in the medical field for close to 40 years, I started very young. And I've seen the evolution of medicine. We have evolved so much. And again, autism incidence from the time when I was in medical school, that autism was a rarity, that we rarely devoted 10 minutes to it, to where autism stands now. The change has been enormous. And the learning that curve has obviously steepened, and yet we still don't know very much. And there is a lot of confusion, unfortunately, thanks to all this online communications and forums. So there is good information, bad information, terrible information. People taking advantage of this entity offering cures for something that we know it's not a disease, it's a developmental disorder. So the aim of this talk is to inform people of the history of autism, the evolution of autism, where we are right now in terms of the condition and its many facets. We want to give people hope that, even though autism it's a permanent condition, like I said, it's not a disease. You cannot cure autism because it's not a disease. It's a developmental disorder. We're getting better at diagnosing this earlier. And we know from studies that the earlier you start with interventions, typically the better the long-term outcome for these children. So we want to, continue to improve the awareness in the general population about this condition so that it can be identified early. We can talk about it more openly. This used to be taboo. Many people used to keep these children in their homes for fear of being criticized, but we want them to just understand what the status of this is, and to really be careful, because there's a lot of quackery going on right now. And even though as a profession we realize that there are some bad apples out there, but we still strive to be and keep a high standard of excellence, and obviously honor and respect for the patients and their families.
Autism is truly impacting our community, and the numbers continue to grow. If you'd like to learn more about the condition, please visit our website, gatewaychc.com, or call 956-8100 to find out about treatments through our very own Dr. Daniel Garza. That's going to do it for today's installment of Gateway Today. To catch a full rewind of this episode and all of our other episodes, please head over to our YouTube channel, and don't forget to smash the subscribe button or scan the QR code. We remind you that our doors are open to all, no matter if you have insurance or don't have insurance, and invite you to experience the best in high quality medical, dental, and behavioral health care simply by starting your journey to a healthier you at gatewaychc.com or by calling 956-795-8100. We thank you again for watching this episode of Gateway Today, and until next time, remember, your health is your wealth, so take care of it.